Deep vein thrombosis, DVT, is a serious medical condition that requires prompt attention and treatment. In this video, we will delve into the world of DVT, exploring its causes, symptoms, treatment options, and preventive measures. Understanding DVT. DVT occurs when a blood clot forms in the deep veins of the body, typically in the legs. This clot can be life-threatening if it breaks loose and travels to the lungs, causing a pulmonary embolism. It is essential to recognize the signs and symptoms of DVT to seek medical help promptly. Symptoms of DVT. The symptoms of DVT may vary from person to person, but common signs include swelling and pain in the affected leg, warmth and redness in the affected leg, weakness or cramping in the affected leg, skin discoloration or ulcers. If you experience any of these symptoms, seek medical attention immediately. Treatment options. Treatment for DVT usually involves a combination of medications and lifestyle changes. The primary goal is to prevent the clot from growing, breaking loose, and causing further complications. 1. Anticoagulation therapy. Blood thinners, such as heparin or warfarin, are used to prevent the clot from growing and prevent new clots from forming. 2. Thrombolytic therapy. Clot-busting medications, such as TPA, are used to dissolve the clot. 3. Filter placement. A filter is placed in the vena cava to prevent the clot from breaking loose and traveling to the lungs. 4. Compression stockings. Wearing compression stockings can help reduce swelling and prevent blood from pooling in the legs. 5. Surgery. In some cases, surgery may be necessary to remove the clot or repair damaged veins. Lifestyle changes. In addition to medical treatment, making lifestyle changes can help reduce the risk of DVT and its complications. 1. Stay active. Regular exercise can help improve blood flow and reduce the risk of clotting. 2. Maintain a healthy weight. Excess weight can increase pressure on the veins, increasing the risk of DVT. 3. Avoid prolonged sitting or standing. Take regular breaks to move around and stretch. 4. Stay hydrated. Drinking plenty of water can help prevent blood from becoming thick and sticky. Preventing recurrence. To reduce the risk of DVT recurring, continue anticoagulation therapy as directed. Monitor for signs and symptoms of DVT. Maintain a healthy lifestyle. DVT is a serious medical condition that requires prompt attention and treatment. By understanding its causes, symptoms, treatment options, and preventive measures, you can reduce your risk of developing DVT and its complications. Remember, if you suspect you or a loved one has DVT, seek medical attention immediately. Thank you for watching. Don't forget to like and subscribe for more health-related videos.